Now you as a doctor, people come to you and say, I have pain in the face, the whole face, and it is only on the left side. And it is so severe that I cannot take any more. People say I have pain in this area, most likely due to dental causes. Pain between the eyes. It is also felt through the trigeminal nerve. Pain on both sides of the nose. Most likely sinusoidal pain. Painful eyes. It is also due to a disease. The pain is conducted by the trigeminal nerve. Pain in the forehead. It is also conducted to the brain through the trigeminal nerve. Deviation of the mandible. It is also due to problem of trigeminal nerve. If you notice the mandible position is deviated to the right. Now, the problem of this patient is that he loses occlusion. So it's difficult for him to eat. This is not facial palsy. This is deviation of the mandible. The very painful condition is called trigeminal neuralgia, and its Latin name is tic douloureux. This is how it is pronounced. It is an attack of stabbing unilateral facial pain. It's facial pain, therefore it is involving the trigeminal nerve. Stabbing means starts very suddenly, lasts short time, and it is unilateral on one side. And it is along the distribution of one or more sensory division of the trigeminal nerve. The most common nerve affected in tic douloureux is the maxillary. Now the pain is paroxysmal, meaning that it starts suddenly, it is severe and disappears. It lasts seconds up to 2 minutes, and then it disappears. And it recurs. This is trigeminal neuralgia. Now, remember, we need to learn the trigeminal nerve and as much as we can, and then we apply our knowledge, because we are being prepared to become doctors and professional. Now, professional people know so many details about their profession. Because I had a discussion with some of the students in the practical, and they were complaining of that there are so many details for their subjects. Now, you cannot treat people with general knowledge. General knowledge can be available to anybody, but the details what make you a doctor. You cannot treat people with general knowledge. And the knowledge we are learning is lifelong. We learn now, and we are going to use all our lives. Now the question is your knowledge well built, sound and strong, or shabby? Not well built. It looks like a wall, but it's It's very weak. Remember, learning is fun. Now, the story is consisting of answers for these questions. We are concerned with where is the problem. This is the general plan of trigeminal nerve. This is the ophthalmic division. You may notice that it is around the eye and the forehead. This is the maxillary division, located inferior to the eye where the maxilla is and the teeth, and the mandibular concerning the buccal area here, the mandible, the mouth, and the teeth. Trigeminal nerve is the largest and most complex cranial nerve. You have seen this image. The skin distribution of the trigeminal nerve is in this way. V stands for trigeminal, fifth cranial nerve. V1 is ophthalmic, V2 is maxillary, and V3 is mandibular. The starting point is here. Do you know what are these? The superior and inferior colliculi in the brain stem. This upper part of the very long nucleus is the mesencephalic nucleus. It is concerned with proprioception. This dilated small nucleus is called the main sensory nucleus. It's for pleasant sensations. And this long nucleus coming down the brain stem and extending to the spinal cord, upper segment of spinal cord, down to 3 or 4 or 5. This is concerned with unpleasant sensation. These 3 are sensory. In addition, we have a motor nucleus, which is concerned about muscles of mastication. That's the mesencephalic nucleus, main sensory nucleus, and the spinal nucleus of trigeminal. Now, sensations will go from the 3 branches. If it is pain and temperature, it enters the brain and it goes to the spinal nucleus. If it is pleasant, it is going to the main sensory nucleus. شوفوا يا شباب، حضوروا يا أخذتوا، فاللي بده يطلع خليه يطلع دفعة واحدة. اللي مسكر باب البرين تبعه خليه يطلع. والله غريب. قل له انت باب البرين مسكر تبعك ولا هم. يلا بسرعة لا تعطلونا. The main sensory nucleus is concerned with pleasant sensation, and the mesencephalic nucleus is concerned with proprioception. Proprioception of what? Of muscles of mastication and of muscles of facial expression. That means that fibers from the fascial jump to the trigeminal nerve. And we've seen that when we talked about the facial nerve. The other component is this motor nucleus descending fibers down to only the mandibular for muscles of mastication. Now, discriminative touch, especially input from the mouth, it comes through the three branches, runs on the same side, ipsilateral, through the dorsal trigeminal thalamic tract, and at the same time, these sensations cross and ascend through the medial lemniscus. Pain and temperature sensations, they also come through the three main branches, and the pain and temperature sensations, fibers cross to the other side and ascend through the spinal lemniscus to the thalamus. The two parts of the thalamus, and now in the very near future you will be asked to examine the trigeminal nerve.
First we test sensation, starting with light touch.
I'm going to touch your face with some cotton wool. Please could you close your eyes and tell me when you feel me touch you.
On both sides, test the three divisions of the nerve. The ophthalmic,
Now.
maxillary,
Now.
and mandibular.
Now.
Repeat the test for pain sensation.
I'm now going to touch your face with a small pin. Please close your eyes and tell me if you feel it sharp.
Carefully test each of the three areas on both sides.
Yes.
Be aware that brainstem lesions may cause sensory loss in an onion skin pattern.
Yes. Yes. Yes.
Carefully dispose of the sharp and use an orange stick to test touch on the anterior two-thirds of the tongue.
I'm going to touch your tongue with this. Please close your eyes and stick out your tongue. Thank you. Do you feel it the same on both sides? Yes.
You could also ask the patient to indicate with a hand when they feel you touching them. To assess the motor function, look for wasting in the muscles of mastication.
Please clench your teeth.
You should be able to feel contraction in the masseters and estimate their bulk.
Against my hand.
Carefully provide resistance to mouth opening, testing the pterygoid muscles. Next, we test the corneal reflex. Draw out a wisp of cotton wool and dampen it to form a gentle point.
I'm going to gently touch your eye. Please look up for me.
Carefully depress the lower eyelid and lightly touch the lateral edge of the cornea. Look for direct and consensual blinking. Lastly, the jaw jerk reflex.
I'm gently going to tap your chin.
Ask the patient to let their mouth hang loosely open. Place your forefinger across the midline between the lower lip and chin. Look for reflex shutting of the jaw. It is normal to have an absent or minimal response.
Thank you.
This is what you will be asked to do in your introductory course to medicine. The question is going to be, examine the trigeminal nerve. Now we know the central connections of trigeminal nerve. We're going to follow its exit from the brain, and it exits on both sides of the pons. Here's the pon, here's the point of exit of trigeminal, and there is a ganglion here, because the major part of the trigeminal is sensory, and sensations, they need to relay first in a ganglion outside the central nervous system. And this ganglion is called semilunar ganglia or Gazerian ganglia. And then the nerve is going to divide into 3 branches. This is the mandibular, this is maxillary, and this is ophthalmic. Now, this is the pituitary gland. This is the optic nerve coming through the optic canal. This is the middle cranial fossa. And on the side of the body of the sphenoid, we have the trigeminal or semilunar ganglia. This is the semilunar ganglion. That's the ganglion. This is the ophthalmic division. This is the maxillary division, and this is the mandibular. This image is telling me that the Gazerian ganglia is present in a cave of the subarachnoid space, bathed in CSF, and then it exits the subarachnoid space into the subarachnoid space. This image is telling me that this is the semilunar ganglia dividing into 3 branches. Now the motor part, which is only going to muscles of mastication, comes out separately, and it is under the semilunar ganglia, and it goes down to the mandibular division. We know this place. This is the pituitary, this is sphenoid air sinus, and the maxillary, the ophthalmic and the maxillary are in the lateral wall of cavernous sinus. The mandibular is going laterally and posteriorly. So the ophthalmic nerve, which is V, stands for 5th cranial nerve, and 1 stands for ophthalmic, the first branch. It has 3 branches. The lacrimal going to the lacrimal gland, the frontal is going to the forehead, and the nasociliary is going for the nose and the eye. And it comes into the orbit through the superior orbital fissure. This is the annulus of Zinn. And this is the lacrimal nerve, this is the frontal nerve, and this is the nasociliary nerve. Where are we? This is the roof of the orbit. If we take the roof of the orbit, everything is in its place. This is the frontal nerve. The frontal nerve goes anteriorly and then divides into supraorbital nerve and supratrochlear nerve. This is the supraorbital nerve. This is the supratrochlear nerve. And this is the area supplied by these 2 nerves. Where are we? This is the olfactory nerve. This is the other olfactory nerve. So this is the midline. roof of the orbit has been removed, and this is the optic nerve, and the nerve which is pointed by this probe is the lacrimal nerve, running on top of the lateral rectus muscle. This is the frontal. As it goes anteriorly, divides into supratrochlear, supraorbital, and this is the lacrimal nerve on top of the lateral rectus, reaching the lacrimal gland. This is the trochlea. This is the infratrochlear nerve, supplying part of the medial parts of the eyelids and root of the nose. This is the supratrochlear and the supraorbital, supplying the forehead, and this is the lacrimal nerve. When it gets out of the orbit, it's going to supply this area of the face. The infraorbital is going to supply the lower eyelid. Which nerve is being blocked here? Infratrochlear. Which nerve is being blocked here? Supraorbital. And which nerve is being blocked here? Supratrochlear. Which nerve is being blocked here? External nasal. Again, these are the two olfactory nerves. This is the midline, and this probe is pointing at this nerve, which is crossing superior to the optic nerve from the superior orbital fissure going medially. This is the nasociliary. This is a cleaner dissection of the nasociliary. It goes on the medial wall, and it gives these branches, several of them, they enter the eyeball posteriorly through lamina cribrosa, and they bring sensation from the eye. Pain, for example. So the corneal reflex, when you touch the cornea, the impulses will come through the long ciliary nerves. Then it continues to the front on medial side and sends this branch that goes to posterior group of ethmoid hair cells. And then another branch to the other group, anterior group of ethmoid hair cells, and this anterior ethmoidal branch will re-enter the skull through the cribriform plate and exit to the face, forming the external nasal nerve. And the rest of the nasociliary will continue and emerges to the face and will form infratrochlear nerve. Then this is the oculomotor, and this is the ciliary ganglia, and the nasociliary nerve is going to send branches, suspend this ganglia, and then several nerves enter the eyeball, also bringing sensations, but sending sympathetic and parasympathetic to the ciliary body and the iris. We've seen physical examination of trigeminal nerve. Touch the cornea. Corneal reflex The pathway involves, first of all, the afferent limb is cranial nerve number 5, trigeminal, mainly nasociliary branch, and the response is facial nerve, closing the eye forcefully. This is the distribution of cutaneous sensation of the ophthalmic. Tip of the nose, the bridge, the root, upper eyelid, and then temporal area up to the vertex of the head. And we have seen this image previously. This is testing what? Supraorbital branch of the ophthalmic. This is pain sensation. Now, this is the story of the ophthalmic division.
Maxillary nerve. The maxillary nerve, the second division of the trigeminal nerve, is purely sensory. Course and relations. It arises from the convex anterior border of the trigeminal ganglion. The nerve leaves the middle cranial fossa through the foramen rotundum to reach the pterygopalatine fossa. It traverses straight in the upper part of the fossa and enters the orbit through the inferior orbital fissure, hence it is called the infraorbital nerve. The infraorbital nerve, in fact a continuation of maxillary nerve, runs forwards along the floor of the orbit in the infraorbital groove and appears on the face through the infraorbital foramen. Therefore, in its course, the maxillary nerve traverses 4 regions in succession: the middle cranial fossa, the pterygopalatine fossa, the orbit, and the face. An important point to be noted here is that in the pterygopalatine fossa, the pterygopalatine ganglion is suspended from the maxillary nerve by 2 roots. Branches and distribution. Maxillary nerve gives off the following branches. In the middle cranial fossa, meningeal branch, which supplies the dura mater of the middle cranial fossa. In the pterygopalatine fossa, ganglionic or communicating branches, 2 in number, to pterygopalatine ganglion. Zygomatic nerve enters the orbit and divides on the lateral wall of the orbit into a zygomatical temporal branch, which passes through a foramen in the zygomatic bone to supply the skin of the temple, and a zygomatical facial branch, which passes through the foramen in the zygomatic bone to supply the skin of the face. Posterior superior alveolar nerve enters 1 or 2 foramina on the posterior surface of the body of maxilla and supplies the mucous membrane of the maxillary air sinus. Then it breaks up to form superior dental plexus, which supplies the molar teeth and adjoining part of the gum. In the orbit, or the infraorbital canal, middle superior alveolar nerve passes downwards and forwards along the lateral wall of the maxillary sinus, joins superior dental plexus, and supplies the premolar teeth. Anterior superior alveolar nerve runs in the anterior wall of the maxillary sinus through a bony canal called canalis sinosus and divides into dental and nasal branches. The dental branches join the superior dental plexus and supply the canine and inferior teeth. The nasal branches appear in the lateral wall of the inferior meatus and supply the mucous membrane of the lateral wall and floor of the nasal cavity. An important point to be noted here is that the superior dental plexus is formed by posterior, middle, and anterior superior alveolar nerves. On the face, palpebral branches turn upwards and supply the skin of the lower eyelid. Nasal branches supply the skin off the side of the nose and the mobile part of the nasal septum. Superior lateral branches supply the skin and mucous membrane of the upper lip.
Right, this has saved me some time. Now, we have gone through this piece of information. This is the semilunar ganglion. This is the maxillary foramen rotundum. That's foramen rotundum. Gets into pterygopalatine fossa. This is the pterygopalatine fossa. This is the maxillary nerve. This is nerve of pterygoid canal, bringing sympathetic and parasympathetic stimuli, runs through the pterygopalatine fossa, going floor of the orbit. This is the infraorbital. These are branches of the zygomatic, superior alveolar, middle superior alveolar, and anterior superior alveolar. This is what the film was missing, that the greater palatine and the lesser palatine, then the sphenopalatine and the pharyngeal branches. We have seen this suspending the ganglion of two branches from maxillary nerve. This is the story of infraorbital. This is the zygomatic branches, and these are the nasal branches from the maxilla. This is the sphenopalatine ganglia, giving rise to the greater palatine for the hard palate. This is the greater palatine, and this is the lesser palatine for the soft palate. And this is the distribution of skin sensation of the maxillary. This is a branch of zygomatic branch. This is zygomatico-temporal. This is blocking the zygomatico-temporal. This is zygomatico-facial. This is the area supplied by the infraorbital branch. It's the side of the nose, upper lip. The bridge of the nose and the tip is supplied by ophthalmic through the external nasal. This is the infraorbital. This is the greater palatine, the roof of the mouth and the hard palate. And this is the sphenopalatine coming from sphenopalatine foramen. This is the middle superior alveolar nerve. This is the posterior superior alveolar nerve. And now we know these alveolar nerves. And we know that this is testing maxillary nerve. This is revision of maxillary nerve, communicates with the pterygopalatine ganglia through two small nerves, and the branches are infraorbital, zygomatico-temporal, and zygomatico-facial, the nasopalatine, the three alveolar nerves, the pharyngeal nerves, and the palatine nerves, the greater and the lesser. Now, كان طلعتم من الأول ليش هسه؟ Where are we? This is the middle cranial fossa. This is the emerging trigeminal nerve. This is the ganglion, semilunar. This is the ophthalmic division. This is the maxillary going to foramen rotundum, and this is the mandibular. The mandibular goes down to the infratemporal fossa through foramen ovale. That's foramen ovale, and this is spinosum. And this CT scan is showing you the position of the infratemporal fossa, which is medial to the ramus of the mandible, and the roof has the foramen ovale. Foramen ovale is point of entry of mandibular division. This is the main trunk of mandibular division. اترك التليفون يا باشا. And this red line is the motor part of the trigeminal. The motor part does not mix with the ganglia and does not mix with the mandibular division. And it comes into the infratemporal fossa. This is the infratemporal fossa roof, lateral wall, and medial wall. Medial wall is the medial pterygoid process and the wall of the pharynx. We have muscles in the infratemporal fossa, the lateral and medial pterygoid muscles. And this is the mandible, this is the ear. Here we have the main trunk of trigeminal. This is foramen ovale, and the main trunk is going to divide into anterior and posterior branches. Here's the story of a strange nerve. Two roots come and then join together to form what's called the auriculotemporal. From its name is going to the external ear and temporal area, and the middle meningeal artery goes between these two roots to enter foramen spinosum. That's the story of auriculotemporal nerve. These are the deep temporal nerves which are going to supply temporalis muscle of mastication. This is the story of the auriculotemporal, which goes towards the auricle and temporal area. This is the buccal nerve, which is going to the buccal area, sensory. And this is the lingual nerve, going to the tongue. And this is the inferior alveolar. The inferior alveolar gets into the ramus of the mandible through the mandibular canal towards the mental foramen, and it's going to supply the lower teeth and emerges as mental nerve. supplying the lower lip near the midline. This blue arrow indicates that this inferior alveolar nerve, although it is mainly sensory, it has a motor component which is going to leave the nerve before entering the mandibular canal, and it is going to supply the mylohyoid muscle forming the floor of the mouth. Is the lingual nerve, and here's the inferior alveolar nerve, and this is the motor part which is going to the mylohyoid, and this is the way chordae tympani sends taste to join the facial nerve, and this is the parasympathetic part coming from the facial nerve to go to the submandibular ganglion. The main trunk also supplies tensor tympani and tensor palati, two tiny branches coming from the main trunk, two tensors. Medial pterygoid, these are the branches supplying the two tensors, and these are the deep temporal branches supplying the temporalis. You know what's this? It's a ganglion in this area. This is the area supplied by the mandibular nerve. This is how you test sensation of mandibular. This is the way you test muscles of mastication. You are testing here the masseter, and you are testing here the temporalis. And here's the jaw jerk test. Okay? Thank you. I have left you on e-learning as many YouTube films as possible. Okay?